I'm Bevy Miner, a longtime advocate of interoperability in the healthcare industry, and I'm excited today to announce our guest is the General Manager for the Cloud Fax Division of J2 Global, John Nebergall. So John, start by just telling me a little bit about your journey and why you're excited about where you are, where you've landed, what you're doing at J2 Global, and your background.
Well, first, thanks for having me, Bevy. I've followed your work for a number of years, so I'm very excited to be here today. It's interesting. I come from a background of healthcare IT, having worked for a number of years at Allscripts, moving on to a time that I spent at Zinx Health with clinical decision support systems. I've been a adjunct professor at the University of Illinois in their health informatics department, as well as did a number of years at Orion Health on their HIE product and, of course, their Rhapsody integration tool. And I would never in a million years have thought I would end up in the position of running a business that was faxing. And yet here I am, and I'm actually very excited about that. Once I started understanding and really doing the research on the strong position, the dominant position that fax has in healthcare communications, it really came to me that, if you're going to try and change healthcare, if you're going to try and really drive interoperability, you should really start with the product that people are using right now as the point that you kick that off. And rather than trying to ignore fax or sweep fax under the rug, trying to get rid of fax, why don't you start there and build off that and be able to take people on a different kind of journey?
That makes total sense, John. So given that, and with your focus on interoperability, since this is a virtual HIMSS interview, tell me what you think are some of the hot, topics. We would always be discussing this if we were sitting on the floor at HIMSS. What's happening in 2020? What should we watch for in 2020? What do you think that is?
Interoperability continues to be at the forefront of what people in this industry are most interested in. Interoperability, data, and how data is used to bring healthcare forward. Those are always at the top of the list, and it's interesting about interoperability because probably for the last 15 HIMSS, you could have probably said interoperability was at the top of the list. Yeah. And I think it's an exciting time to be able to come to HIMSS with a point of view on how to solve this problem pragmatically rather than trying to start with some new unproven technology.
That definitely makes sense. I know we've been talking about interoperability for a long time as well. So based on your journey moving into a cloud faxing environment, why do you feel there's still so many providers using paper faxing as a means of sharing patient data, and it's not even secure?
Well, it starts with, if it ain't broke, don't fix it, right? You're talking about something that is tried and true and is reliable and is HIPAA compliant. And while there are absolutely situations where the security of a piece of paper in any clinical environment starts to become a liability from a privacy point of view, the reality is that many of the workflows that occur in these offices, at these clinics, revolve around paper. And when you introduce something like a paperless system, a lot changes at the practice level. A lot changes for the folks that have to administer patient records. And change is hard. It's difficult. So I think that fax is comfortable. And the reason that people still use fax machine and paper fax is more than anything else, that's what they're used to, and that's what fits into their workflows.
Yeah, that makes total sense. We have that same history with EHRs, where physicians didn't want to move off of their paper files. So, you actually support the CMS campaign of Axe the Fax and the goal of getting rid of faxing by 2024. So that's kind of interesting, since you really are trying to promote a cloud fax solution. So explain that.
We've had a number of conversations with CMS, and they've been very good conversations. And what CMS is trying to do is to get rid of the fax machine. And when they say the fax, they really mean the fax machine, that piece of machinery that creates paper, that piece of machinery that can give a busy signal when you're trying to get information critical to the care of a patient into a practice or out from a practice, and that piece of equipment that is really almost a impediment to efficiency. And I 100% agree with them. In the conversations that we've had with CMS, as we've started to talk about fax as a protocol and not an it. Fax is a way of communicating and not a machine and not a paper. That understanding is something that the CMS team supports. And in fact, in a number of the webinars, seminars, and talks that CMS has had over the last 6 to 8 months since we've started our conversation, they've been specific. They're trying to get rid of fax machines, and that's something I completely support.
Oh, that makes total sense. I guess it doesn't sound as good to say axe the fax machine. So we'll give CMS credit for coming up with a great campaign called Axe the Fax. And thank you for explaining that, because it did seem like an interesting campaign that you would be supporting. So I know that you're here at, you were going to be here at HIMSS, launching a new product called Consensus, and like many other vendors that are no longer exhibiting because HIMSS is not happening. Tell us a little bit about this product. Tell us what Consensus does to help advance that goal that CMS has of moving off the paper and the actual fax machine.
Well, I think that goes back to the reason that I joined J2 to begin with, and that the pragmatic approach to interoperability. Understanding that fax as a platform that can start to lead a change was really the idea that Consensus was born out of. What Consensus does is it starts to bridge the gap between different forms of electronic protocol that are recognized as HIPAA compliant and in use today by providers all over the country. So the first thing that Consensus is, and I guess you don't say this about new products, but there's nothing in Consensus that isn't tried and true technology that's used every day in healthcare as part of workflows that are executed hour after hour in every clinic, in every healthcare organization. So you have faxing via cloud fax, which is a very secure digital approach to being able to move unstructured data. The faxing component, in fact, is high trust certified in addition to HIPAA compliant. What Consensus builds on that. On the same platform, you now have the option of sending that information via direct messaging. So a secure direct message can be sent from that same platform, and the sender has the option of sending information either way with a simple click and being able to match the way they send it to what fits in their workflow. Building on that, Consensus also offers the opportunity that hasn't been something that's been available to providers who don't have an EHR before. Consensus is also a mechanism to query for patient data. If you can imagine a provider without an EHR seeing a patient who has had an acute episode at a hospital, or maybe been out of town on vacation and had to see a provider for some condition or some problem that occurred, and trying to get that record, it's a pretty difficult task if you don't have an EHR. And what you find is that many areas of the country don't have EHRs. There are practices in rural areas, there are practices in urban areas that are economically impacted. There are some providers that for various reasons haven't invested in an EHR. But to ultimately penalize the patient by not giving that provider the best information that they can have at the point of care, we saw as fundamentally wrong. So consensus is a way for that provider to query local EHRs, to query a network that is connected to HCOs, and be able to draw back patient data through a simple query process, whether they have an EHR or not.
So I know you probably haven't spent time reading 1,800 pages of a final rule that was just released on Monday. We've been waiting for this for about a year, as we called it, the data blocking rule, so to speak, but there's a lot more interesting nuances to this final rule. Just curious, how do you think consensus can support this new interoperability governance, or can it?
You know, it really can, and it's almost as if the launch of consensus, along with the new rule, it's almost like a hand in glove kind of fit. When you're talking about certain kinds of communication now that really have to take place, transition of care communications back to PCPs, being able to ensure that the data sharing rule is in place in your environment. Consensus is immediately able to meet those demands. Whether you're sending a patient record to a PCP who has a fax machine or an EHR, Consensus as a platform can accommodate that. Consensus can accommodate the ability to share data without any extraction fees. Consensus really is positioned to be a facilitator of that communication in a very seamless and a very transparent way that is both secure and reliable, using technologies that are time-tested for their reliability.
You know, one of the interesting things about this new final rule is it specifically calls out the requirement for electronic notifications of transitions of care. And we all know that a lot of errors do occur when patient is transitioned from one setting to the next setting. Surprising that this isn't happening, but you know, it certainly isn't in many silos. Do you think Consensus can help with that level of transition of care to help comply with this industry requirement?
Absolutely. That electronic transition of care can be, once you introduce a platform like Consensus, can be used as an electronic fax, an electronic direct message, or HL7 Fire, which is also supported by Consensus. So you really have the full gamut of technologies that are in use in healthcare available in a single platform that allows you access through a dashboard that you know, gives you the ability to comply with this new CMS rule. We think it's really a perfect fit for what CMS is trying to accomplish, and we're very proud of the fact that in anticipating the need to expand the amount of electronic communication happening between providers, that we've been able to bring something to market to support that at a time when the market is moving much more rapidly in this direction.
What's also really interesting about this final rule is the amount of focus on the consumers and the patients, and the fact that patients, it's about time that we really concentrated on giving them their data and allowing them to have that data in a very easy way to use it, and transparency of that data. And patient health records, PHRs, have been around for a long time. They were a requirement in meaningful use for every EHR vendor to be able to support and counter data inside a personal health record. Yet the percentage of patients that use these solutions is really very low. And why is that, do you think? And how will this new rule really make a difference in that? And are you working on anything that might help in that respect?
As I spent time doing the work I did at the University of Illinois, what I learned was that patients become very interested in their health care in very specific kinds of situations. Patients become very interested in their health care when they have an acute episode, or if they have a specific condition that needs to be managed. Caregivers become very interested in health care when somebody who is a loved one develops one of those two kinds of situations. And of course, parents are very interested in the health care of their children. Those tend to be where people start to aggressively interact with their provider to get information, to have information that they can share and that they can understand. Most of us who are going through our lives in healthy everyday living really don't spend much time or effort to interact with the health system to gather this information. What CMS is trying to do is to make it very easy to do that. So right now it's kind of difficult. You have to want to do this. You have to want to go to your physician's patient portal, or the center of the universe for getting health records is not the patient themselves, but it is the holder of that record. And you can even imagine if you're a patient that has multiple specialists that you need to see, you're going from portal to portal to portal to try and gather your records. It really becomes a labor. What CMS is trying to do is to say, hey, let's make this very easy with an API, an app, where a patient can easily query their record and be able to pull that into a environment where they're in charge of it. They can choose to share it or not share it. Along those lines, we also, in looking at the rule, recognize that not necessarily every provider, again, is going to have the kind of system that allows for easy sharing of patient records. So when you think of the wide spectrum of physician capability of record sharing or entity capability of record sharing, you really have to go back and cover all the bases again. You've got to cover an HL7 kind of protocol, you've got to cover direct protocol, and you've got to cover fax protocol. And with that in mind, we've been closely on the heels of being able to help consumers with this kind of law, help patients with this kind of rule, and have a product that we've actually soft launched called My Health Inbox. And what it does is it allows the patient to gather records from their physician in any way that physician can share those records. In other words, if that physician does have an EMR and can share those records electronically via an API, easy. That's a simple way for this patient to get their records. But suppose, like so many other transactions in healthcare, suppose all that physician has is a fax machine. How's that patient going to get that information? What we've done is devised a way for patients to receive information no matter how a provider wants to send it. So if all they've got is a fax machine, that patient can still get their data electronically. If all they've got is the ability to send a direct message, the patient can still get that direct message. And we base it on the technology that we've already got in place that, as I mentioned before, is HITRUST certified to be able to securely and privately get that information to the patient. And we're very excited about this product. We haven't officially launched it in the marketplace yet, but we know that we're going to position it as part of the Consensus platform, and certainly going to be an option for providers to comply under the law.
Well, great. Thank you so much for your time today, John. You can learn more about Consensus at consensus.com. J2 Global has set up a virtual hymns page, so this interview will be available there to listen to again. And if you have additional questions regarding Consensus, you can send those at info at consensus.com. So thanks again for your time, John. Appreciate it.
Thanks for having me, Bevy. Really enjoyed it.